Hello.
Hello.
Right.
Viral test. Like
Right.
I can't.
Getting motion sick.
I
Willie's
think
running in circles with headphones on. And
Zoom's having some issue. It's no longer working that whole, mute upon entry setting. I mean, it's set like that for this meeting, but it just isn't doing it all of a sudden. I don't know why.
everyone mute yourself or we're going to hear all of your harassment of the bad things you said about LJ, and it's going to be embarrassing for everybody.
Right. If by bad things they say about LJ, you mean bad things they say about you.
I think they could be very entertaining.
I think it would be kind of fun.
Got something bad to say, come sit next to me.
All right, it is 12:16. We're a little late, but it's a little bit sunny today for possibly the last time for the next 12 months. So maybe we'll go ahead and get rolling. So welcome everybody. Actually, there's more people popping in as soon as I say that. So quick update, and then I'm pretty much going to turn it over to LJ because I know she is the person that has all the information everybody is interested in right now. So as far as where we stand, so lots of evolution here recently. So we have seen a bit of an uptick in case rate. It has not been huge, but certainly in some of the surrounding communities, I'll say like Wyoming County in particular, there's been a bit of an uptick. And it seems to be in pockets. And again, largely due to congregate meetings, especially with unvaccinated individuals. So that seems to be the big source. Hospital census remains pretty consistent, but the average age of those hospitalized, the dichotomy continues to grow. So it's either younger and younger who are getting admitted who are unvaccinated, or older and older who are vaccinated. Seems to be kind of the moral of the story to some extent. You may have heard, I don't know that this has penetrated the outpatient arena yet, but there has been increasing presence in our own region and in some of our own hospitals where there is one attorney who is local, who is filing suits on behalf of patients to get ivermectin treatments for patients who are hospitalized. There have been 2 cases thus far where patients were ordered by a judge to receive ivermectin, where the hospital team had to prescribe and administer the drug on the judge's orders, even though it was against the medical recommendation of the hospital. So the attorney has a flat rate of about $5,000 that they're charging for this. They have this bucket of pseudoscience that they're presenting. And the judge has largely taken the tact that, if it's this end of life situation, if there's no clear and convincing evidence that it will immediately harm the patient, then why not give it to them? So that's presenting some issues. It seems to be catching on a little bit. And there's a lot of uproar, both from the hospitals, from providers, from nursing groups, really concerned that the judicial system is basically forcing them to provide care that they believe is not only not helpful, but potentially even harmful. So I have not heard of that penetrating the outpatient setting, but I will say that the 2 providers where this prescription was generated, one of them was an ear, nose, and throat doc, pediatric ear, nose, and throat from Utah. And the other one was a rheumatology nurse practitioner from New York State, but was out of the local area that had written these prescriptions. So, clearly probably no reason, and they were writing these for adult patients in the ICU. So just know that this, probably will continue to be a thing going forward. And, we are seeing increasingly in the hospitalized group, patients who want ivermectin, but will refuse monoclonal antibody treatment or the like. So it does make it even more complicated. So that's definitely becoming an issue. Other than that, I think the big conversations at this point have to do with boosters. So, Pfizer boosters are pretty readily available. I know the U of R is now back to providing boosters for healthcare workers who were vaccinated by the U of R. There was the announcement that the Moderna and J&J boosters will be approved. There has been some discussion as to whether, if you got Pfizer, should you receive a Moderna booster? So that conversation has been ongoing. Dr. Falsey recently gave a presentation where she showed some data where it really looked fairly convincing that it didn't matter which booster you got, just that the booster did seem to improve antibody response and circulating levels of antibodies. So, I think there has been I'll say small pockets of people who got Pfizer, but really want the Moderna for their booster. While it probably will become possible to do that, there's no clear and convincing evidence that is necessary at this point. So more on that will kind of continue to evolve, and we'll see what the FDA recommendations ultimately become. Likewise, people probably saw, I think it was this morning, the White House put forward their plan for pediatric vaccination pending FDA approval. And the discussion is still ongoing that potentially by the end of this month, that pediatric vaccination could be reviewed and approved, but certainly probably in the coming weeks for sure. So I'm sure LJ will have much more to talk about with that. So I think probably we're going to start entering this phase of boosters and pediatric vaccine becoming the focus of attention in the short term. At the same token, we're starting to get a smattering of flu cases. So as we start to talk about return to school, return to work, we're going to see those folks who manifest symptoms that are going to be difficult to differentiate, and that will become a point of discussion where I know, for all of you, you're already overloaded and urgent cares are at all-time highs. So, those considerations remain front of mind and still an ongoing part of consideration and conversation. Beyond that, I will say from a testing standpoint, the testing availability still remains very good. There's still, at the major labs, I should say, I know there's still allocation issues for the office-based testing, and I have not heard, LJ can jump in if she has, when or if there is an anticipated release from that, that the kit allocation will increase. That looks like a no.
I think the practices could comment on that, but what I'm hearing is they're getting, they're back ordered hundreds and thousands of doses in some instances, and getting like sort of sporadic shipments, which are much lower than what they are looking for. So it's very erratic. I'm not hearing, unless if there's a practitioner or an administrator from practice who wants to add to that, but my understanding is we're all just sort of don't know.
Yeah, and I would say even on the hospital end, we're getting tens of kits at a time now, not hundreds by any stretch. So the number of kits that the hospitals are getting really doesn't even meet the desire for the rapid testing alternative. So, I know there has been discussion on and off about invoking the Defense Production Act. I know it has even been talked about by the Biden administration, but I don't think that has actually come to fruition at this moment. Even though there had been, I think as recently as a couple weeks ago, talk about having rapid PCR kind of upregulated and available in communities. And we still get pockets of groups that are going to offer rapid PCR testing for a few hours here, but nothing that I'm aware of that there's any longitudinal plan where they're going to have, guaranteed access and availability. So that still remains a limitation. So I would still say the laboratory-based PCR testing remains the backbone of our testing plans for the moment. Other than that, I don't think there's anything terribly new for me. So I will turn it over to LJ. And if something comes to mind, I will jump back in afterwards.
Thanks, Chad. So we really wanted to spend the bulk of our time together here talking about pediatric COVID vaccine, but I just wanted to level set a couple of topics quickly first. Just with regard to, I mean, all of you will have received the latest information we were able to share out around opportunities for centralized testing for patients just looking at COVID testing to be able to support the kids getting back into school more quickly or getting identified more quickly for children with mild symptoms. So I wasn't going to go into that because there's not anything that is different from the messaging that went out on Monday to all of your practices. We did try to highlight that messaging to your practice administrators too, just to make sure that, I know it's hard to keep up with all the emails, so we wanted to be efficient in our communication to your practices. If there are questions, I'm happy to entertain that. I think the one caveat is I recognize that the workflows for these have not been maybe everything that everyone has wanted to have happen. The workflow at the county, as you know, is actually point of care testing with 60 appointment slots available each day, although they didn't have appointments available for today. And that's point of care drive-through where there's no referral required. And that is where families can sign up online and come through. They are asking for those to be kids where their symptoms have now, they're either very mild without fever or they're resolving and trying to get back to school. So that's a different workflow. The other sites, including the Galveston Children's Hospital, UR Medicine site that really have been, that has been set up just to support practices so that there is another workflow for testing. It's not an urgent care. It is not taking your patients away in any way. But we did hear the feedback that having our primary care teams be responsible for ordering and then for following up and then for contacting the school and all of that was just not helpful. So the one thing that is in place now is that site, as well as the 2 independent urgent cares, are following up on any testing that they are doing. They are reaching back to the families by phone as soon as the test result is available, and they're able to see it very quickly within, they're watching every day and throughout the day to make calls back on those, and then faxing to the school that information provided that the family did give a signed consent. So I just want to make sure that people understood that workflow is a little bit different. They're still encouraging an order from a healthcare provider because they didn't want to necessarily pull patients out of your queues for those of you who do point of care testing in your office. We're going to continue to look at that workflow and make sure it makes sense and is supportive for your practices. The other couple things I just wanted to mention, just so people aren't confused, there is an initiative for point of care testing in Ontario County schools. And it is point of care PCR for any of you out in Ontario County or who have patients from that area. I wanted to clarify it is PCR. We double checked on that, but they're going to be doing some testing within schools and within Monroe County, both within RCSD and also, I believe it may be Fairport schools. They are trialing point of care PCR testing at the school level in the nurse's office. This is not widespread. These are just pilots, but it's hard when things are all happening and you're hearing different things from different families and different kids. I just wanted for your teams to be aware that those things are also being piloted. So your feedback is always welcome. If you have questions about things, happy to connect you with folks who can answer those. That's all I was going to say about the COVID testing. I don't think there's any questions in the chat. The other, I feel like really bad news that is floating out right now as a rumor. I'm going to say it's a rumor. But I think many of you are hearing this and we will get clarification about this. For all of you who have been doing point of care lead testing with the LeadCare 2 analyzer and who have been waiting on back orders because of test kit recalls, there is something out there right now, a rumor that's going around that they are not going to be producing those products in the future. So I'm just putting it out there because you're all messaging me. And so I want you to know that we are aware that we have messaging out to our contacts at Magellan, and we will put something out today or tomorrow as soon as we get clarification around that. And obviously we will need to be thinking about our lead testing initiatives if we do not have point of care access anymore. It's been hard enough to do this during the pandemic. So I just wanted to be clear that we are looking into that and we'll be sure that you have information directly about that. So having touched on both of those topics, pediatric vaccination. I just want to talk for 1 minute, and then I'm going to open this up for conversation. So if anyone does not care for pediatric patients and doesn't want to stay, on this call, don't hesitate to drop off, although many of you are pediatric and family medicine and med peds teams. So in our area, pediatric vaccination is definitely going to be a collaborative effort, right? Between primary care, potentially some centralized, smaller community pods, potentially with schools. But I think right now it's a matter of looking at how the systems, meaning the hospital-owned practices, will be sort of working through their workflows. We recognize that URMC hospital and practices in Rochester Regional will have some of their own workflows in this space. So at AHP and as part of this call, we really are very concerned about the independent community practices, both peds and family medicine, and making sure that we are doing everything we can to support your workflows and support your patients. And I think that one of the things that was remarkable to me earlier in the pandemic, when it was time to vaccinate the 12 to 15-year-olds, a lot of your teams got on board with sort of nice little support strike teams or support from the county, whether it was in distribution of vaccine and having people come out to show you how to set up the workflows. And I think that the majority of your practices are able to vaccinate. But the pediatric vaccination thing obviously is going to be different now. And we're anticipating we need to be ready to go the 1st of November. I think that folks are aware that pre-ordering is available or coming available. Steve Cook can talk about this more specifically. And I think there's a few questions that we have for your teams to make sure that we can be supporting you the best possible. Are you planning to order your own vaccine supply administered through your practice, and what supports do you need? If you don't have that kind of a workflow established and you want to, what can we do to help you? If you don't have that kind of workflow established and really don't feel you can vaccinate in your practice, how can we assure that your patients are receiving access to vaccine? So I think, thank you, Stacey Graham, the pediatric vaccine is available now for order. So this question and this conversation is really timely because nobody wants to step on each other's efforts. We want to really support primary care practices in delivering vaccine for their patients, but we recognize that from a staffing standpoint, from a workflow standpoint, knowing that this is not easy to do just in the normal workday, it will require weekends or evening hours for vaccine clinics. We want to be able to see what is needed. So I'm just going to say Steve Cook has taken a medical lead role for this with Monroe County, sort of across our region. I appreciate Steve for all the work he's been doing on the state level and the county level already. Steve is here on this call. Kim Povek, who from AHP, who helped with a lot of the vaccine pods, is going to be devoting some of her time. AHP is really pleased and grateful. I'm grateful to Kim that she's going to step in with her operations experience and expertise in this space. I can tell you that other members of the AHP team, will be ready to help our pharmacy team, as well as obviously the communications that run through Renee, my support too. So you've already put some questions in the chat. I saw that Joanne Cordero raised the question, will the county be ordering vaccines in the way that they have been doing? And I think that this is kind of our question back to you a little bit. What are people thinking about? Are they ready to, are they wanting to order their own vaccine? Are they looking for redistribution through the county? And because I think we need to plan accordingly. So I'm going to stop talking for a second. I'm going to ask if anybody wants to unmute, or we can keep control of the chat, or turn it over to Kim and Steve to ask some very, further specific questions. And I would just ask you guys, we're trying to use this meeting rather than set up another one and take time from your evening or your clinical time. So as much detail as you're comfortable offering, we can follow up with a specific survey to practices, but as much information as we can get in this meeting will be really helpful.
Figured if it was somebody you know us, we had no name.
Okay, I'm gonna talk again. Pediatrics wants to order through the county is what I'm hearing. And this nice messages coming through about MCDPH process has been good. Is there any, if there are practices that feel differently about that, feel free to post. And that was our general thought. Again, trying to look at you all as a unit. We know you're independent, but like to think about how we can support you as a unit.
I got a private chat from a practice outside of Monroe County that indicates they've been ordering vaccine directly from the state. So maybe some difference between inside Monroe County, outside Monroe County.
Okay, thanks, Renee.
I'll also, is it okay to throw out some questions?
Please. Yeah.
It's really helpful feedback to hear about the process with Monroe County. Just a bit more months has really been operations and logistics. And I partnered with Steve, who was our clinical lead. What we're to understand is what operations, logistical and staffing support do you possibly need to be able to meet the demand that we're space.
Kim, I can read the chat while you're asking questions. So people are saying that space is tight within their practices. I think, and I'm thinking that means in terms of your normal workflow.
Hi,
Marietta,
this is
go ahead.
Marietta. Yeah, definitely. You know, the office is so full from 8:30 to 6 that it's going to be hard to have rooms to administer vaccines, have patients wait the 15 minutes. We certainly will take advantage of our waiting room because right now we don't have patients waiting there. But that's the thing, we're like, during the daytime hours, it's going to be very challenging. But then staffing evenings and weekends, really just, we kind of get stuck right there.
So I'm seeing a lot of staffing concerns come up. So I think it's great for us to start focusing on evenings and weekends for this. Okay, so a lot of staffing. Given that most of my work has been in adult vaccinations, one of the things I've seen as a strength of Steve Cook's is his ability to educate clinicians on how to give vaccine. If we were to get a group of nurses who were interested in vaccinating, but necessarily didn't have the extensive pediatric experience, but were willing to learn and have someone on site to teach them and go through that process with them, would that be something you'd be open to?
I saw one yes.
Okay.
Yeah, I'm seeing more yeses. Okay. I also want to point out the message that Steve Cook just posted in there, that LPNs can vaccinate under the PrEP Act. Steve, this was one of the questions that I had brought to you from some of our providers. Can we clarify that? That's LPNs unsupervised, not because the way we do it in for flu vaccine clinics, or for example, is that they are supervised by an RN.
Yeah, that's correct. We checked with the State Department of Health, and they thoroughly checked with the federal government that under the PrEP Act, LPNs can vaccinate. The question would come in, is there something more you're asking them to do? They can't be like the medical evaluator, medical observation person. So if you have, an LPN and a office staff person in a side room and kids are coming in and getting vaccinated, that's fine. But if someone gets sick and needs to be evaluated, there needs to be at least an RN available to assess for that. So, but they are eligible to vaccinate, and we did get clarification on that.
Thanks for clarifying that, Steve. I think that's really important to a lot of our practices.
I'd like to maybe clarify one more thing. The state has really changed the process to make it easier to order from offices directly. The vials will now come in trays of 10 vials. So you can get, just 10. This first week, they're doing these larger shipments of 30 and in increments of 30. And so they're trying to send those directly to large health systems or practices, but they've had calls from offices that said they can handle it. It comes ultra cold, but it can be put in a regular refrigerator and stored for 10 weeks. The big difference is the distribution. The vial will have 10 doses. So once you open a vial, you have 6 hours. The good thing is that you just give what you can. Don't not give a dose because you only have one person sitting there. There's not fines or penalties for not giving vaccine. So keeping that in mind, they've made the process much easier to get the vaccine into practices directly. So we hope that can facilitate. The county, again, has been a great partner. And we are trying to look at building like this supplemental workforce that could be available to come to offices. And we're talking to United Way and building on their team as well.
Is there anyone from around Equate Peds on?
I don't see the Around team right there. And they may be probably seeing patients at the moment. They did use the United Way volunteer platform, right? They had access to that.
Correct, and we're thinking if it would be helpful to all of you of reenacting something very similar with extra training from Steve, with a specific focus on the pediatric side. We're also trying to recruit some retired nurses and physicians who worked in pediatrics, who would be willing to volunteer some of their time to do this as well. So we're starting to create a running list as well. So if you know of anyone, please send them our way.
So I've been watching the chat, and I think I'm going to try to summarize just to wrap up the question about ordering. It feels to me from the feedback, I heard what you said, Steve, about the state making things easier in terms of ordering and distribution. But I feel like in the notion of we're going to try to get this up and running and get the early vaccinating families and kids in the early time, in the month of November or whatever, going the county route for our practices that have workflows and they know how to do that. That makes a lot of sense for this next as we're transitioning. Obviously, the new ordering process will make it easier for practices to sustain potentially COVID vaccination, and so they may move over towards ordering for themselves. But I'm hearing loud and clear. I just want to make sure I've got that right. You can do a thumbs up. You can just stick a yes in there. If anybody disagrees, say, no, you've got it wrong. We want the county to distribute, at least as we're talking about Monroe County. I recognize the outside counties, it may be something different. Yes, okay, perfect. Okay. All right. That's good. I mean, that's the kind of information we need to move forward in conversations with the county, right? Kim, to your question about staffing. You guys are making me laugh. This is kind of a fun chat. I would say that there is full intent to provide staffing support for your practices, recognizing that's the big deal. Is there, would you anticipate, maybe we'll do this by survey by practice actually, but I think it would be helpful to anticipate how much staff you feel you would be able to devote. I would hope that there would be able to be staff to be able to, schedule that vaccine clinic out of your practice because it would be your patients, right? And then it's really the person power of doing the vaccinating, recording the vaccination, I think that you're looking for. Do I have that right? Scheduling you guys support for vaccination clinics outside, yes, okay. Okay, awesome. All right, so what are we missing in this space? Kim, what other questions do you have?
Supplies. So if we were to bring a strike team to your office, One of the questions we would have, and this is just a logistics thing, would you, and this is, honest answer would be great. Do you want us bringing supplies, or do you have supplies in your office that we would be able to utilize? And this may change practice to practice. So truly just your honest thought about what would be best from a workflow perspective for you and your teams. Okay.
A variety of responses in there around supplies.
So just even from seeing what's coming in thus far, so part of our experience, and Steve, I'm not sure how deeply you got to witness this, part of what happened is sometimes those supply kits would never be full. So we would always have an extra tote on hand. So if we would likely bring an extra tote along with us to cover the volume of vaccines. Does that make sense? So we'll absolutely use what comes with the vaccine, but then have a backup tote.
Right. I think one of the key things to this, Kim, is the part of the redistributing, which the county is prepared to do and is looking at, is also their staffing to cover that. So I say that with just the idea of mind that if it's a matter of redistributing, but they don't have people who can drive, could a practice go pick it up? Just looking at potential options, that may be something that we need to consider. If, if 8 practices want vaccine delivered on the same day and we only can reach 4, it may be an issue of having people come pick up.
Steve, that's actually what they do already.
It is.
They don't get
I know
vaccine
they
delivered.
had traveling teams, but good.
Yeah,
All right.
it is part of their workflow. So this is what we need. We want to keep the workflow as much the same as it has been and not change that up right now where we need to be responding acutely to a large volume of patients. That's
now,
awesome.
Another question for you all, just so that we know how to be prepared best. Again, we know that sometimes you get vaccine cards with that redistribution, sometimes you don't. And so I was curious, what is the consistency of that? Are you consistently getting the volume and number of CDC issued vaccine cards that you need? Okay. Okay, that's awesome.
Okay.
That's fantastic to hear.
Kim, I have a question. It's a little shift. I'm just thinking about, for our larger practices, I can absolutely see you readily being able to, fill a vaccine clinic, right? With a number of kids. In our smaller, single provider or, 2-person practices, we can reach out to you specifically, but just wondering, is there a way to maybe centralize a support strike team so that it might not be your patients coming exactly to your practice, but they would have a place to go and that we could collaborate with you around that. So I don't know, I can't tell who's on, but we know who you are. We can certainly reach out to you, but just from an efficiency standpoint, I'm just trying to think about how we utilize the people because we're going to need strike teams going different places. We're going to be trying to do this in a consolidated fashion. We want to be as efficient as we can. Okay. So we've got some people saying they would be fine with that, with some type of consolidation. Okay.
One of the conversations we might want to have too, just around the billing side of it, is how do we sort that out on the back end or the front end? If practices have 3 different EMRs, how do we want to? Oh, that'd be awesome. Yeah, that's a great idea too, Steve. But so we can work on those workflows to make sure that people get appropriately billed and paid for the patients that may be coming to another location. I know there's some legality involved in that, but we can start to sort through that as well. Another question I had, what roles do you need support with? RNs to vaccinate was one that came up. In a lot of clinics, we've tag teamed someone to draw and do observation. So we've combined that in one role. So I was curious, what other roles do you need, or do you think those 2 roles would be sufficient? Someone to draw and observe, someone to vaccinate. You guys are easy.
Kim. Hi, Kim.
Hi.
Quick question. I think
There's
Aaron,
Oh, I'm sorry, there's a check-in paperwork in there. Sorry, Steve, like there are a couple of other help with registration and check-in, Kim, is the other thing that's coming through in the chat. Sorry, Steve, go ahead.
Yeah, no, I think the one thing that we want to be mindful of is, you know, what will fit in a flow and what we have capacity for. So, you know, if the practice, it's easily, well, I don't want easiest. If the practice orders vaccine, they get the supplies and the team can also bring vaccine. That's obvious step. But if a strike team comes with a non-vaccinated or a clerk person, and we'll have to look into this, you would either need to give them access to your EMR to let them enter information. And then do they need to know how to function that EMR password, whatever. So I just worry about the logistics and privacy related to that. And that way it stays in your system, it gets loaded up into NISIS and you can bill for it. The county has their own, you know, EMR data system that they take to all their community sites, which does this as well, but that is not your EMR. And I don't know that there's a way to transfer that data into your EMR. So just putting that out there in terms of where the options are.
I think, Steve, that's a really good point. And I think, I mean, you guys have given us great information here right now in terms of like the broad strokes that I think we need to be able to move forward with the next level of meetings. I hope the practices all would be amenable to us following up with some specific details. It may be just a very brief survey so that we can figure out some of these pieces. And we can do that through your practice administrator, I think would make the most sense so that it's not everybody in the practice is needing to answer a survey. I'll trust Kim and Steve to figure out what that would look like. But in terms of any other broad picture things, Kim, Steve, anything last? Because I want to give people time to get back to whatever break or patients they've got.
Nothing else here on my end.
I mean, we are looking at, the state is looking at some broader strategies, trying to do, you know, community type kid focus clinics. The plan is not to have kids 5 to 11 come to mass vaccination sites, the adult ones that we saw, but they might do like kid parent clinics or do school-based clinics. We're exploring those options and trying to make partnerships for that. And we are trying to explore at the state level, increasing the Medicaid rate. The payment rate is $40 and all payers should pay $40 for the administration fee. We have heard of some providers that if they counsel have also billed for a counseling visit, which I would strongly endorse, that if you spend time counseling a family, bill for that and bill for the administrative fee. So we are looking at what some other states have done to raise the administrative fee, but right now it's $40 and every plan should pay that.
Do you think it's realistic that administration fee might be raised in New York State, or is it hard to tell?
It's hard to tell. They seem really interested in it. And as they're looking at the logistics of it and how to do it, it's getting local questions. So we're hoping, but I think this is where I would encourage us to advocate back that, you know, can the plans put in some money? Can the state put in some of their own money? Right now, the $40 is entirely from the federal government. So could we advocate to the state to just put in their share, you know, put in some additional money, and could plans pay for it? So I would want to pursue any possible action, and any advocacy we do that helps us on a pediatric side, like help with testing, is going to help us be able to vaccinate more too. So the work helping practices to test, I think, hopefully will be a relief.
Thanks for that, Steve. We appreciate it. We appreciate the work that you're doing, that our local AAP chapter is doing, Monroe County Medical Society, you know, HP and others all advocating for increased reimbursement. I think that's really important here. But the staffing, the workflows, the support, trying to, I mean, I know vaccinating is what we do in peds, right? So we really do want to do primary support to your practices to do this as best possible, as opposed to leaning in on centralized sites if we don't, you know, I mean, they will be needed in some fashion, but probably not as the primary vaccinating force. If you have other comments, questions, please let us know. Love the summary the summaries popped up in the chat from Mendon Pediatrics, from, I think it was from Panorama Peds, and others who have figured out some of these workflows in MedEnt. In the spirit of sharing, we might just reach out to you guys, capture those and make sure that all who are on MedEnt can utilize the same way to keep the workflows efficient. And with that, I'm going to wish you all a really good day. Thank you so much for everything that you're doing. Chad, Renee, I think Renee, you might have an announcement before people sign off. Renee, was there an announcement about the behavioral health calls?
Yes, the behavioral health calls are being put on pause. The call last week was the last one that'll be held for now. The team is going to use that time afforded them to solicit some feedback from stakeholders to see how better to meet practices needs for behavioral health resources. Still plenty of opportunities, ways to reach out to the BHI team for your needs. I'll make sure we publish the BHI team email if you need any, you need a drive-by consult, phone numbers, et cetera, the contact information for the team. So that resource is still there for you on a one-to-one basis. It's just those Tuesday calls that are on pause right now.
Okey-doke. Chad, last words?
I got nothing. I got this up the whole time almost. This is great.
One last word. I think Chad may have made it sound that Strong is providing boosters to healthcare workers not employed by the U of R. And that may have just been my perception of what he said, but that is not the case yet. They're hoping to open that up for those of you who did get your first two from Strong Employee Health. As soon as they're able to open that up for all healthcare workers, whether employed by the U of R or not, we will let you know. But at present, your still best bet is to go to other places for your booster.
And Renee, can I just ask you to save this chat and send it to me? Because
Okay.
and copy Kim as well. I just want to be able to go back through and make sure. I might have missed somebody's comment or question in there because it was fast and furious for a while.
Yep.
So we will go back and we'll take a look at that. Have a great day, everybody, and thank you so much.
Take care, everybody.
Bye.